Hi, everyone. It's Dr. Jacqueline Cortez Salmons here at Transformation Health and Wellness. Welcome to Wellness Wednesdays. We're happy to have you here for episode 7, I think it is. It's an important topic that we're talking about today. I really wanted to get into the terminology that we use a lot of times regarding preventative medicine. I think it's been a largely underrated, sort of overlooked aspect of medicine that's so critically important for your health. And it's something that I really wanted to address today because it's primarily what I focus on nowadays. Definitely, I do deal with disease management, which I think is in large part what corporate medicine is now doing. We do a lot of, medication management. We make sure that we don't have interactions between our medications that we're taking. We manage high blood pressure and cholesterol. That's all very important. Absolutely, it's critical. But I think that what is also important, if not even more so, is the prevention of those disease processes in and of themselves. And that's what's so critical. I think particularly a lot of folks have been very disheartened by the entity of mainstream medicine over this COVID crisis that we're still in the middle of. Feels like a lot of the restrictions are being loosened. We're being able to get out there. Some restaurants are opening slowly. Other entities are opening slowly. People are kind of going back to work. But in the meantime, we still haven't addressed some of the larger issues that really this whole crisis kind of uncovered about the way that medical management is run at this time. I cannot tell you how many patients have come through my doors, and I've screened over 100 patients for COVID antibodies at this point. We've done probably 20 or so of the nasal swab screening. I'm a little itty bitty tiny practice over here in Anaheim Hills. Of course, I'm always happy to grow that, but nonetheless, like where I'm at now, I've just been open a year. So to have that amount of individuals seeking out my care indicates to me that in this small community, their needs otherwise are not being met. And that's, I think, what's so important to be focused on, that a lot of my patients who have come to me have told me I couldn't get in to see my primary care because they said I wasn't sick enough. Oh my goodness, I can't even believe that that's a comment that is being said to a patient. Now, I will grant it that it's probably not the physician, him or herself, that is saying that, but the fact that there's even this mindset within healthcare industry that you're not sick enough to be important enough to have an element of my time. You're not sick enough to be able to come in and ask the questions that are critical to you in your life to be able to get your needs addressed. I don't accept that. I really have a very hard time with that because I feel like each and every patient out there, each and every individual is so very important. It's so critical that you understand that you need to listen to your own gut feeling. I just had a discussion with a patient last night. I said, what do you feel here? What do you feel in this core of your being regarding, decisions that needed to be made or how we were going to go about a certain plan of care? And I think that's what's so important, is that you do listen to that. And then when you do, and you call the doctor's office and then they tell you, well, you're not sick enough, or maybe it sounds important, but not today. I think we kind of start to ignore some of those gut instincts that tell us that there's something else going on. And I think that that's what's really critical, that we actually tune into, listen to, and address. So coming back to the whole idea of prevention, if you actually look at the CDC website, and I know the CDC has been very controversial lately, but it is a great resource for a lot of statistics, particularly some of the older statistics that aren't necessarily as charged as some of the newer statistics and so forth. But if you take a look, the top 10 most expensive chronic diseases, right? So this is something that we spend so much money on in America. Cardiovascular disease, which we know is largely preventable by lifestyle choices, smoking-related issues, alcohol-related issues, diabetes. Those are the top 4. Number 5 is Alzheimer's disease, arguably whether that's preventable or not, just because, again, there's so much we don't understand about the brain health, how we can prevent and so forth. But we do know that staying active, having an active mind, being engaged on a regular basis does help to lessen or prevent the progression of Alzheimer's. So that is important. So, but even those top four guys are so preventable, again, in large part, right? You can't fight the gene pools. There's something to be said for that. If grandma, grandparents, everybody had diabetes, chances are, even if you weigh 95 pounds and you're a vegan, you may still get diabetes. I mean, that's just some of the reality that's out there. But I think we all know when we sort of sneak in things here and there and we're not making good food choices, we're not making good physical activity choices, that there are things that we could prevent and be very proactive about as far as preventing disease down the road. Now, what's kind of made me frustrated about the management of healthcare as we know it in the corporate kind of mainstream medicine world is that a lot of times it's very problem based. And you're going to see some of my posts on Instagram and Facebook this week about this, is that it's a problem based diagnosis, right? Problem based management. We actually have our SOAP note is subjective, objective, assessment, and plan. And that assessment is our problems. Okay. So what is your problem? If you don't have a problem, then I can't finish my note. I can't make a plan for you, right? That's exactly how we're trained, is to look at things from a diagnosis standpoint. I've actually had a patient who was very, very sick recently and being told that, well, I can't do anything for you. I don't have a diagnosis. I can't treat you. I can't help you. And it was this standstill. It was very stagnant at that point, the conversation between that family and the physician, with that physician just complete deer in the headlights. Then if I don't have a diagnosis wherein I have a recipe of how to fix you, then I can't do anything. So there wasn't even a recommendation of, hey, you can do X, Y, and Z, avoid certain foods, hydrate well, do these other lifestyle things that may help and assist in that manner. Like even if we don't have a diagnosis, there are still things you can do to better your overall health. Right. And I think that that's where the disconnect is happening, where it's like you're not sick enough, you don't have enough symptoms, you're not feeling enough of X, Y, and Z things, so I can't do anything for you. Then we wait, and I've had some patients being told this, let's wait another year, we'll recheck, and if we have a problem then we'll do something about it. As opposed to saying, gosh, I'm looking at your A1C levels, they continue to rise, and even though we're nowhere near diabetes, we don't want to get there. We don't want to be operating from behind the eight ball or kind of on a defense mechanisms or scrambling ourselves out of the hole we've dug ourselves into. We want to actually prevent getting into that hole to begin with and say, gosh, we need to do some lifestyle changes here. These are some things that you can modify, right? And that's what I like to term or phrase proactive medicine. So you're actually empowering yourself with the knowledge to help manage your own body. You're responsible for your body rather than putting the responsibility for your health into somebody else's pockets, right? I tell my kids this all the time. Don't put your happiness in somebody else's pocket. Don't rely on somebody else to provide for you, whether that's wealth, whether that's happiness, whether it's your health, right? Don't put it in your physician's pocket, okay? Take that control back. Now, again, there are disease processes, obviously, that will always need surgical management, that will always need medical intervention. There's absolutely a time and a place for those things. 100%. I firmly believe that. Yes, hands down. However, that being said, there's a lot of things that we can do on the path towards, preventing heart disease, preventing diabetes, and so forth, so that you can do actively to manage your health and you can feel better now, you can be active now, and you can have that knowledge base to know what your body can and can't handle and watch it to see if there are any changes. All right, let's see. What are the main lifestyle factors you can improve to reduce disease risk? And this is the interesting thing, right? I always say it's that simple and it's that hard, but it really comes down to diet and exercise. Okay. And when I say that, we have a lot of like what we affectionately call our gym rats, right? Folks who kind of live at the gym 2-3 hours on the treadmill and we're running and we're doing all the things. But that really only comprises about 10 to 20% of your overall health. Now, it's fantastic for cardiovascular health. It's great for your metabolism. It's wonderful for muscle mass. All of those things are bone health, right? Exercise is really, really important. But the rest of the day, it's all about nutrition And I hate to use the word diet because then we think of deprivation, we think of things that we have to take away, but really it's about giving your body the things that it needs to function appropriately. And this comes down to your micronutrients and your macronutrients. You may have heard about macros. I actually am not as well versed in it as I would like to be, but just to give you the rundown, it's basically carbohydrates, fats, and proteins. Those are the three main macros that you need. And then depending on whose school of thought you follow, what that percentage breakdown comes to. That's something to work out with your nutritionist or your health coach or your personal trainer. That being said, the micronutrients are what are so critical as well. So we talked a little bit last week about hydration and the importance of hydration. And again, coming back to sometimes we're seeking foods, not because we're hungry that we need nutrients. We actually are seeking those foods for hydration. Okay, so we're trying to get those foods into us so we have appropriate fluid. Hi, how are you? Oh, my friend just came in, but I'm in the middle of a live thing. So that being said, then we'll sometimes seek out certain foods because we're lacking in a micronutrient, right? So a lot of times when we're craving chocolate and sweet, like I just want that flavor of chocolate, is not the flavor of chocolate that you're looking for. You're actually lacking in magnesium. Okay. If you're craving chips and salty, crunchy, again, a lot of times you're not craving chips, you're craving phosphorus. Okay, so there are certain indicators that your body is telling you, I want this thing. And so then we seek it out in the foods that we choose. Now, if the nearest, local food that you have is crap food, then you certainly can't anticipate that you're going to be on your path to wellness. So you want to surround yourself where it's easy grab and go foods, because we all have busy lifestyles, right? Nobody's going to sit there and tell me like, I'm busy, I'm busy, I'm busy. Obviously, we're all busy, but there are foods that are like ready-made, right? Carrot sticks, apple slices, oranges, tangerines. Oh my God. Okay, I can't even lie to you. My favorite is tangerines that are pre-peeled. I don't know what the thing is, but I cannot stand peeling oranges because it gets all in the rinds get into the cuticles on my fingers. And I can't. So when I get them pre-peeled, I will be much more likely to grab that than like a piece of bread or a piece of something sweet or a cookie. It's much more easy for me to grab that and I feel satisfied. I actually feel sated because I know I'm getting that vitamin C, I'm getting those B vitamins, all of the things that my body can really utilize effectively. And it recognizes whole foods as actual foods. When we're eating things that are sort of morphed and mutated, like bread is not grain. Bread has grain in it, but it is not grain. Right? If you're eating whole grain like brown or wild rice or quinoa, those things are actual grains that our body recognizes as food. When we actually have, sorry, there's a lot of things happening. When we have things that are kind of morphed and mutated, our body's like, what the heck was that? Like, I don't even know what that was. So can you give me some phosphorus now? And so what do? We grab for another handful of chips, right? Instead of a piece of fish or one of these other elements that's going to have the phosphorus in it that our body's actually so that's what I mean by proactive medicine, is something that you want to educate your body or educate your mind about what your body is requiring so that you can adequately sustain it. And again, then if disease happens, then it happens. Right? Again, there are appendicitis, for example, is just going to happen. That's not really a lifestyle choice necessarily. So there are things that, stuff is still going to happen. However, you can know in your heart of hearts, hey, I did everything I possibly could to help to avoid X, Y, or Z disease process. It still happened. Then I'm going to need to intervene with actual conventional medicine and possibly surgery and those sorts of things. And that's understandable. But in large part, again, those top 4 elements that are most expensive chronic diseases are actually preventable with just some lifestyle changes. And just to give you like a rough statistic, guys, 6 in 10 people in the United States have a chronic illness. 6 in 10. Look around you. Okay, so we're allowed to have 10 in a room gathered with the COVID crisis. 6 of those people have a chronic illness. 4 of them have 2 or more chronic illnesses, right? And we see these things go hand in hand between thyroid and diabetes, heart disease, high blood pressure, right? They go in groups. Oftentimes, even in residency, I was told that if you don't have 3 problems on your problem list, you're not looking hard enough. What does that say? Right? That was my training, is actually like ingrained into me. If you don't have 3 problems on your problem list, you're not looking hard enough. Your patient has to have more than 3 problems. Okay. So granted, I was an OBGYN, so that would be like labor, premature labor, broken bag of water, those kind of things. But nonetheless, when you have that mindset of I'm always looking for a problem, and if I don't see a problem with you, then I guess you're not that important. That is not the case. You are absolutely important. And if we don't have a problem, then that is the optimal, ideal time to really address how to best optimize your health so that you can continue to be well and we can prevent ever having a problem in the future. Okay, so I hope this really helps. I hope I've answered any of your questions. If you have any questions or if you have a topic you'd like for me to discuss, please comment down below. Make sure you subscribe to our channel so you get updates as to when we post, and that you turn on notifications, and that'll give you a little ding, a little bell to tell you when we've gone live or when we've posted something new. I hope to hear from you soon. Take care. What's up, friends?